we talked about for the spine. So just be aware that you'll need to review some things. So we've already talked about greater trochanter, but we'll do it a little bit more formally now. So for me, I come in and find the iliac crest. Okay, so lateral iliac crest, and you're looking forward to that one. Then you're going to come down. Now for the greater trochanter, simply put your whole hand on the side of the hip. Okay? Because some people wear their pants or shorts a little bit lower, you're going to be misled if you go by clothing, and that's why I use the lateral aspect of the iliac crest as a guide. You can confirm that you're on it on the neck, there's no question, but if you turn, the greater trochanter is going to go in and out. The greater trochanter is important for a couple of reasons. We're going to be using it as a landmark. It's going to be the axis for the hip motions. It also has a bursa that sits right out on the tip of it. And so trochanteric bursitis is actually something that's pretty common in PT, so you need to be able to palpate the greater trochanter, and then right lateral to the trochanter is going to be the trochanteric bursa. Okay? All right. So the next structures are what you're going to find in the femoral triangle. And so we're going to have the adductors be the medial border and the sartorius be the lateral border, and the inguinal ligament is going to be the superior border of the femoral triangle. So what you're looking at up there is going to be the person's left, if we were looking at the right leg. Okay, so lateral is to the left of that image, and the medial is to the right of that image. Okay, so you see the NAV on the top, that's nerve, artery, vein. So from the lateral aspect, we're going to have nerve, the artery is going to be in the middle, and then the vein. This is going to be important for palpating. You can't see from here, at least I can't with my old eyes. There are little green ovals medial to the vein, which are going to be the lymph nodes. Okay? So maybe go ahead and bend your legs up for me. That's good.
Right? That's for wheelchair rugby. Adaptive rugby.
Were you in the chair?
I was in the chair.
Scott struck again.
I was in the, I don't even remember what happened. I just got hit.
Probably Scott.
Probably Scott. Yeah.
Running very intense.
Sorry, not.
How's the adaptive rugby going? How else is doing it?
Oh, it was just at Expo.
Expo.
Oh, okay. Because we actually have someone come in to 541 to talk about classifying athletes who play rugby. And I do have the murder ball video if you're interested in borrowing it. Okay, so remember inguinal ligament, we're going to find the ASIS, and then we're going to palpate and find the ligament. To find all of these structures, we need to go inferiorly. I'm going to have you push against my hand. And relax. So that's going to be that medial border. So I can feel the muscles contract, so I know I need to come back out laterally a little bit. And I'm going to feel for a pulse. Any more time? Okay, and there's her pulse there. Okay. If I want to, so you're going to be slightly medial of midline, right? Then for the lymph nodes, you're going to stay inferior to the inguinal ligament, and you're going to feel for those grains of rice. Are you sick at all? Good. Okay. All the muscles are going to be pretty straightforward, with the exception, when we do the manual muscle testing, the exception is the piriformis. So can you roll over on your stomach, please, and bring your feet up, just on your belly. There you go. Are you comfortable? Mm-hmm. Are you a belly sleeper?
No.
That's what I get for asking.
She sleeps in a ball.
What? So,
Like curled up.
So if the,
Fetal position.
yes, most people would say fetal position. I would ball would be like, I don't know,
Like a cat.
shrew or something, you know, that's not that there's anything true-like about you. Okay, so piriformis, is it a medial rotator or a lateral rotator? Lateral rotator. It's going to attach to the greater trochanter, which we just found, and then over to the sacrum. This is going to be a really important muscle to palpate because it can cause sciatica if it's tight. So you're going to find the greater trochanter. So again, entire palm of your hand, I find it. If I need to confirm it, which I don't, it's right there. I find the sacrum, It's going to be right in between those two landmarks. Now this muscle is going to be running horizontal, or I guess horizontally if she were standing. So I'm going to be palpating that muscle going this direction. A common place for it to be tight is right along the sacrum here. Oh yeah, a little bit tight right there. But you're going to come across. Now it's going to be very important to be palpating the piriformis cross fiber because there's a whole lot of other muscles in this area. Fortunately for us, all those other muscles are going to have the orthogonal orientation, and so we can palpate through the gluteal muscles to get to the piriformis. And we'll know that we're on the piriformis because those fibers are going to be running the opposite way. Okay? All
Can
right.
it be difficult because the sacrotuberous ligament to get to?
The sacrotuberous ligament is going to be a slightly inferior, and it's going to be under the piriformis. The piriformis is not more anterior than sacrotuberous ligament.
Okay, got it.
So sacrotuberous ligament is here, piriformis is here. Okay?
Got it.
Okay. All right. Yep. That's all the things we need to palpate in the hip. Okay? So we're going to go back to your tailbone. You actually have to get up, sorry. So you're going to palpate the greater trochanter. You're going to remember that the trochanter
Yeah, I don't know.
is on
Just
top
kinda
of it. You're going to
skipped all
palpate for the
those.